Welcome to Therapy Facts with Dr. Jenn. The seventh point about the way therapy works is that, as you might imagine, therapy, especially when you're giving it your all, might make you feel worse before you feel better. But isn't that true about most interventions? Isn't it true, for example, when we go to the dentist and we do something as small as a teeth cleaning? I know for me, my teeth cleanings are can be very aggravating. Just having the scraping and all of that. And don't, if I have a pocket or something that's painful, my teeth are getting clean, but as they're getting clean, I'm having some pain. And if I have a cavity that I have to get filled, then that's going to be more pain before I feel better. So therapy is no different. You will come in and you will share your details. And at the moment on site, as you're sharing details, you may actually feel a great deal of relief. But when you begin to think about, especially when you begin to think about your details in different ways, you may begin to feel worse. You may feel worse before you feel better. I bring that up because I know that's what a lot of people fear, and it's okay to fear that. But just know that it's part of the process, that you will feel better. I tell people all the time, if you need therapy or any other medical intervention and you're not getting it, right? So if you have teeth that are with bleeding gums because you have too much tartar on your teeth, you're already having the pain. You're having the pain from not getting the intervention. So if you, and you're not feeling any better. So you're having the pain from not getting the intervention, and you're not going to feel any better. The pain you have is not going to make you feel better. But at least when you have pain that's related to an intervention, you know that you're going to feel better eventually, because the intervention is designed to stop the pain, the chronic pain, and to provide some acute pain to give you the intervention. But then over time, that intervention, the results of the intervention, are going to make you feel better. So don't be surprised and don't be afraid. Now, one of the things that's really a common concern in therapy, talking about feeling worse, is that people will hold out so hard from crying. They will do everything they can do to stop themselves from crying in a therapy session. And because they are afraid, they'll say, if I start crying, I will never stop. Well, guess what? Research shows that most people do not cry more than in the heavy ugly cry. They don't heavy ugly cry more than about 8 minutes before they begin to kind of calm down and the tears start to dry up. And it's really more like 4 minutes, but of course, there's always outliers. So, and of course, there's always starting to cry again. But any one episode of crying, hard, ugly crying, will probably last no more than about 5 minutes. And it may seem like a lifetime again if you are crying in front of someone that you really don't know, therapist, right? You really don't know and you may not feel comfortable with. And so it can feel like an eternity. But again, if you are putting into therapy what you should be putting into it to get out what you get out of it, part of it is what we call that cathartic cry. So allow yourself to cry. Get your money's worth. Go into therapy every single time with the goal. And I laugh just for, that's just sort of my emphasis, my humor is my own coping strategy. But go in there with the intention to cry. Get your money's worth from every therapy session by having at least one ugly cry episode. The therapist is ready. The therapist is expecting. Most good therapists are going to have their tissue ready for you. You know, in the traditional face to face setting, I know a lot of therapy is not happening face to face, so you just have have your own tissues ready. But if you are with a therapist, they will have tissue for you. And we can take it. We can take your crying. It does not alarm us. Um, it's an expectation. We're not going to try to shush you. We will even ask you, what makes you cry? And that will make you cry even more, hopefully, in order to really get down to the emotion. Because very, very often people hold their details so closely and have not worked through or moved, had any movement related to their details because they haven't been able to cry. And so cry, cry, cry. Go in, insist, look for your tear opportunity, and give it all you have.